prostate cancer is still the commonest cancer of men, and still the second commonest cause of cancer death in men, so it's something which we need to take seriously. As I said, the difficulty is that many of our treatments do have significant side effects, and therefore as physicians and surgeons we're always looking for new treatments for prostate cancer which will be just as effective as the old ones but will produce less in the way of side effects. One of the new treatments under evaluation is a treatment called Hifu, or high intensity focused ultrasound. This works by focusing ultrasound into the prostate and causing localized heating, and indeed it heats the tissues between 70 and 100 degrees centigrade. By harnessing computer control, we can at the same time treat the whole prostate gland by sweeping through the gland and providing treatment in multiple areas. Because prostate cancer can be followed using prostate-specific antigen PSA, we've got a great way of seeing whether the treatment's been successful and being able to decide whether or not patients need to go on to further treatment.
Okay, this is the device which goes inside the patient. It has a transducer within the probe. The probe is covered with a condom. The condom is filled with degassed water which circulates through the system throughout the treatment, keeping the temperature down to 17 degrees centigrade.
And that's to assist with rectal
cooling and probe cooling. So it serves two purposes. The gel you see on the outside is to aid contact with the rectal wall.
And does the probe stay fixed like that, or does it move during the course?
The probe stays in the fixed position, and the transducer itself is the device which moves around doing the treatment. In order to ensure the quality of the delivery of the energy, we use perspex blocks which are configured at the same radius that you will find within the rectum. We start off with a plain piece of perspex, and then we immerse the transducer in water and fire the transducer in the way which it would be in tissue. And what we see here is a pattern which has been deposited, that we've chosen this pattern and at 1 centimetre centres to ensure the accuracy of the firing pattern throughout the treatment.
Although the treatment's relatively new in the UK, around the world the treatment has been used for quite some time, and we now have figures out to about 7 years or so. And in that it shows in some patients, and the patients need to be clearly defined, there needs to be patients with localized prostate cancer contained within the gland, moderately differentiated prostate cancer or better, that's Gleason 7 or better. In those patients, they are just as likely to be cured by Hifu as they are with radical surgery or radical radiotherapy. There are, however, some advantages with Hifu that some of the other treatments don't have. Hifu is much more likely to preserve erections in men than the other treatments. In standard radical prostatectomy, up to 90-95% of men will be rendered impotent, not be able to have erections after surgery. In addition, the majority of men will be incontinent following surgery for up to 3 or 4 months. Most of those men will be wearing incontinence pads during that time. For Hifu, 25% of men will lose their erections, 75% are likely to stay potent, and only 10% of men will suffer transitory, temporary stress incontinence, in other words, a leak of a few drops of urine when coughing or sneezing. Less than 1% of men will be incontinent in the long term. A further advantage of Hifu potentially is that it's delivered as a day case. There's no need for a lengthy hospital stay, no time on high dependency units, and no need for blood transfusions such as there may be with radical surgery. Over and above radiotherapy, great advantage is that it's a single one-off treatment delivered on a single day. Patients will be back at home by the same evening, unlike radiotherapy, which usually needs 6.5 weeks of daily treatment. It's probably closest to from a radiotherapy standpoint to brachytherapy, which is usually delivered with 2 treatments, 2 trips to the hospital, one for planning and one for administration. from the perspective of incontinence rates are extremely low with brachytherapy. It's almost unheard of. But where it can be problematic is in the future. As the man ages, he may develop benign prostate disease, and in this setting, TURP, the traditional prostate rebore, may render patients incontinent at a date in the future. In addition, although we believe that results from brachytherapy were going to be good with regard to erections, some of the more recent figures have not borne this out in the longer term. It seems likely that large numbers of patients will lose their erections as time passes, possibly around the 50% mark out at a year. I think there are things to commend Hifu to people, but it's extremely important that the treatment is tailored to the individual. Nobody should be having a treatment which isn't perfect for them, and there's such a wide set of choices for prostate cancer that can be delivered for everybody. The key factors are that the patient has localized prostate cancer that's moderately differentiated or better, and in those patients, Hifu is certainly a potential treatment.